for the next fall if it happens again. So I think these things are happening together, but I just want us to really concentrate on the fact that all around the globe, country after country is dealing with this. And we can talk about why didn't Italy do something, or Spain do something, or Germany do something, or we can really say right now, we all can do something. We can do the social distancing and all of the pieces that we know is starting to work around the globe in country after country. And then when we get through all of this, we can ask the questions about, could we have done some piece of this better as a global community? I will remind you that on February 3rd, the head of the WHO said there was no reason to ever do a travel ban.
I will remind you that on February 3rd, the head of the WHO said there was no reason to ever do a travel ban. No reason to ever do a travel ban. Travel ban. Travel ban. Travel ban.
Until January 14th, that we knew that there was human-to-human transmission, human-to-human transmission, human-to-human transmission, until January 14th.
Until January 14th. Until January 14th.
President Trump expands his controversial travel ban.
The U.S. Centers for Disease Control, the CDC, on Monday confirmed that passengers traveling from China will now be funneled through 11 U.S. airports, best equipped to screen passengers for the novel coronavirus. That's up from 7 airports. According to new restrictions put in place over the weekend, Chinese travelers originating in the People's Republic, even those connecting through a third country, would be denied entry to the U.S. Meanwhile, American health officials say they are working with local authorities to decide where individuals who might be infected will be quarantined. They say no option is off the table. They also say the U.S. is working on possibly evacuating more American nationals out of Hubei province. Across the Atlantic, at an executive meeting of the World Health Organization in Geneva, China condemned what it said were excessive restrictions imposed by a number of countries, including visa rejections and denying entry to persons with Hubei-issued passports.
The World Health Organization's temporary recommendations do not recommend any travel and trade restrictions. We are all in this together. It concerns every country and everyone in this world.
The head of the WHO echoed the sentiments, while commending China on the steps it's taken to prevent the spread beyond its borders.
If it weren't for China's efforts, the number of cases outside China would have been very much higher. And it could still be, but we have the opportunity now to work aggressively to prevent that from happening.
On one hand, it seems intuitive: shut down the border, things will spread less. But it has all sorts of other effects that you might not want. For example, preventing the movement of supplies across borders. So I'm one of the majority of people who do not know whether the travel ban is the best way to go. Happily, I'm not the person who has to make that decision.
The WHO also said it was working with Google to ensure that searches yield fact-based scientific results, and that it's also working with social media outlets to help stop the spread of misinformation.
Enough is enough with the World Health Organization and their ties to the Chinese Communist Party and their lies. The United States, which means the U.S. taxpayer, which means you and me, gives $400 million to the World Health Organization every year, according to data from 2019. And for what? So the World Health Organization can tell us lies and parrot Chinese communist propaganda? World Health Organization official Bruce Aylward hung up the Skype call after a journalist asked him about Taiwan. Why? Because the World Health Organization changed the name Taiwan to Taipei and Environs to appease the Chinese Communist Party. Take a look at this.
Would the WHO consider Taiwan's membership? Hello?
I'm sorry, I can't hear. I couldn't hear your question.
Okay, yeah. Let me repeat the question.
No, that's okay. Let's move to another one then.
Right, because I'm actually curious on talking about Taiwan as well, on Taiwan's case.
In other words, the World Health Organization erased an entire country because they were afraid of making the communists in China mad. The World Health Organization parroted Chinese propaganda about the contagion level of COVID-19 too, and praised China for how they handled it. Al Word, the same guy from the video, sucked up to the Chinese Communist Party by saying, if I had COVID-19, I'd want to be treated in China. Well, China has plenty of urns to go around. After lying to the world about stopping the virus, China suddenly distributed about 40,000 urns with the remains of cremated people believed to probably have died from COVID-19. But we'll get to that in a moment. The World Health Organization has also been flat wrong in their health recommendations. On January 14th, the World Health Organization tweeted, "There is no clear evidence of human-to-human transmission of coronavirus." False. On February 7th, they claimed masks don't necessarily protect you. False. On March 23rd, they warned treating COVID-19 with hydroxychloroquine could cause a drug shortage. False. The free market fixed that within a week. And yesterday, the World Health Organization doubled down and said, we stand by our recommendation that you shouldn't wear a face mask unless you are sick or caring for somebody who is sick. How does that make sense? If it's good for sick people to prevent them from spreading germs, and if it helps medical personnel from contracting the virus, why wouldn't it help everyday Americans not spread or catch the virus too? The World Health Organization is lying. The scientific studies show face masks work. The World Health Organization is telling you a lie. And we know China lied. They lied about the virus itself. They covered it up last year when they knew about it, maybe as early as October or November. The Chinese Communist Party disappeared a doctor who revealed publicly that she was told by Chinese authorities to hide the virus. That doctor is gone now. She used to be the head of emergency at Wuhan General Hospital. Her whereabouts now are unknown. The Chinese Communist Party also disappeared a billionaire businessman from China after he criticized President Xi Jinping how the president was handling the coronavirus. Then, via the Chinese state-run media, the Chinese government is threatening to withhold medical equipment and medication from the United States if we dare to crack down on their illegal behavior in other ways. And they still lie about the number dead. And yet, the World Health Organization keeps choosing to side with the Chinese Communist Party rather than tell the truth. The American people should demand better because it's our money that pays for the World Health Organization, and it's our security on the line if the Chinese communists spread this virus, lie about it, and then cut us off.
Pompeo, the Secretary of State, seems to be to have carte blanche to do whatever he wants. He's not consulting other agencies before acting. And so he has basically banned not only a travel ban on people coming from China to the United States, but he's conflated our immigration policy with a travel issue so that if you're a Chinese citizen now, you can't come to the United States. Most Americans don't realize they've essentially used this epidemic to stop all travel and movement. And one of the outcomes of that, which is just incredibly nuts, is that almost all of the active pharmaceutical ingredients used in the formulation of medicines in America, frankly for the whole world, come from China. And so we will soon run out of drugs for everything. Has nothing to do with the epidemic. We're going to run out of diabetes drugs and heart disease drugs and cancer drugs and all of that, many of which were already in short supply because the ingredients our pharmaceutical industry uses all come from China.
And what's going to happen to all of those drugs being made in China?
Who knows? There's no answer, there's no solution, and now the tension between the United States and China has gotten so high that the foreign ministry issued statements today declaring that America is responsible for a global xenophobic attack against China. And in no uncertain terms, it's very clear that inside China, it's already beginning to play as America is our enemy.
It's easy to forget that while impeachment is going on, Donald Trump is still in office, pushing his agenda forward. Trump is still doing president stuff. And at the top of his to-do list lately is keeping people out of America, starting with supersizing the travel ban.
President Trump is planning to widen its controversial travel ban. The plan will prohibit nearly all people from 7 countries. Now, the new restrictions are expected to be announced on Monday.
Our country has to be safe. You see what's going on in the world. Our country has to be safe. So we have a very strong travel ban, and we'll be adding a few countries to it.
Yes, Donald Trump is expanding his infamous travel ban. And it looks like it's going to be 6 countries from Africa and Asia and 1 from Europe, just to throw people off the scent.
The new US rules mark a sudden escalation in Trump's response to the virus, and they seem to catch US allies and the markets off guard. As well as making political waves, they will be a huge blow to travelers and to airlines operating routes across the Atlantic. The tourism industry has already been hit hard by the virus, as governments tighten restrictions and travelers think twice about whether to go on vacation in these uncertain times.
Well, Trump's travel ban caught a lot of people by surprise here in Europe. Let's go over to correspondent Bernd Riegert, who's standing by for us in Brussels. Hi, Bernd. EU leaders have been holding an emergency meeting to discuss this decision from the White House. What's emerged from that meeting?
The EU Commission and also the 27 member states issued a statement saying that they disapprove of this travel ban, especially because there was no consultation, no warning that this would come. And the EU says that doesn't make sense because this is a global virus and you cannot contain it by just forbid people to travel, and asked to comment on the allegations the President Trump made in his speech. The spokesperson of the Commission only said, "We have more serious things to do than to deal with that."
What you talking about, Kimberly? And we can speak now to Dr. Giacomo Grasselli. He's an anesthesiologist from the University of Milan. He's coordinating the network of intensive care units in Lombardy. Dr. Grasselli, we know you're very busy at the moment. Thank you for joining us here on DW. Can you give us an idea of what the situation is in hospitals right now in Lombardy?
Yes, to give you an idea, I can give you just some very simple numbers. Like before this crisis, we had in Lombardy around maximum 800 ICU beds available for people. And since the start of the epidemics, so in the last 20 days, we have admitted to our ICU a total of more than 900 people. Of these, let's say 120 have been discharged, about 90 have died, and the remaining, around 700, are still there.
Now, China's decision to lock down the city of Wuhan, the epicenter of the COVID-19 outbreak, may have prevented more than 700,000 new cases. That's according to research published today in the journal Science.
Protecting Americans' health also means fighting infectious diseases. We are coordinating with the Chinese government and working closely together on the coronavirus outbreak in China. My administration will take all necessary steps to safeguard our citizens from this threat.